Dear friends, we are amongst friends. We all share the same passion. So for all those who are in Canada for the first time, welcome. To all those who are returning here, I'm very happy to see you again here in Ottawa. If we're gathered together, it's to talk about an issue that's often missing on the program of the major international conferences. It's to further a cause that's often neglected, but that's very important. That is the health of adolescents.
That you bring. We value your commitment to improving the health and well-being of adolescents around the world. As the conference title says, our aim over the next 2 days is nothing short of unleashing the power of a generation to help build lasting change. Before I continue, let me extend a warm thank you to the Canadian Partnership for Women and Children's Health for their vision and for co-hosting this important conference. And to Amina Mohammed, Deputy Secretary General of the United Nations, who will deliver what I am sure will be an inspiring keynote address. We are honored that you were able to join us today. With an unprecedented number of adolescents in the world today, nearly a quarter of the world's population, there is no question that healthy and empowered adolescents are going to be key to achieving the Sustainable Development Goals. We have made huge progress in improving human health in recent years. More women are surviving pregnancy and childbirth. More children are living to celebrate their 5th birthdays and beyond. But adolescents, especially girls, are still left behind. Adolescent girls are more likely to die from AIDS than any other cause, while suicide is the second leading cause of death amongst this group. Every 10 minutes, an adolescent girl dies from violence. 62 million of them are not in school. I have met with girls facing challenges like these over and over again during my travel. But regardless of their situations, I can always see a spark of potential in their eyes. I see hope, energy, and passion. But these girls are struggling. They face systematic inequality and barriers, violence, discrimination, stigma, exploitation. They suffer from poor health and poor nutrition. They don't have access to equal education. They don't have equal access to education, you got it. Too many adolescent girls are either not going to school or leaving school too early because they are forced into marriage or into motherhood instead of pursuing their education. Or because their school does not have proper sanitation facilities to help them manage their menstrual hygiene. Or because they are simply too afraid of walking to school because of the threat of sexual violence. And because all of that, adolescents in developing countries cannot reach their full potential. And that is why we are all here today, to unleash that power, to help adolescents, especially girls, overcome the challenges they face, to become powerful agents of change for a better world. The physical, cognitive, social, and emotional growth that happens during adolescence sets the foundation for lifelong well-being. According to The Lancet, some of the most effective actions we can take to improve adolescent girls, adolescent health, go well beyond healthcare. To be healthy and empowered, adolescents need access to quality healthcare, services, and information. But they also need a good education. They need quality nutrition, to be free from violence and discrimination, to be safe, and to have the skills and freedom to make their own decisions about their bodies and their lives. For adolescent girls to have a voice and a choice. Il est clair que les adolescents
It's clear that adolescents, and especially girl adolescents, have not been able to fully take advantage of progress in development. We can and we must do more for that generation. Next week, the high-level working group on health and human rights of women, children and adolescents, of which I'm a member, will publish a report that includes recommendations for their implementation in order to consider human rights within the systems, within the national systems of health. This is an important report because it will guide the actions which the governments with which we work can and must take in order to make sure that everyone, including male and female adolescents, have access to health services and reliable information. This integrated approach, based on human rights, and includes rights in terms of sexual health and reproductive rights, is something that's too often ignored. And unfortunately, adolescents are affected by this. And it's even more the case for girl adolescents, because sexual and reproductive health is too often excluded in our approaches. Soon, I will have the opportunity of presenting the details of our new feminist policy of international aid, which not only recognizes the equality of the sexes, but also aims to allow women and girls to develop their full potential.
Gender equality and the rights and empowerment of women and girls is at the heart of everything that we do. We also support the She Decides movement that works to ensure that women and girls can decide themselves whether, when, and with whom to have children. Canada already committed $650 million over 3 years for sexual and reproductive health and rights to help achieve this goal. The Her Voice, Her Choice initiative will provide comprehensive sexuality education, family planning, contraceptives, and access to safe and legal abortion. It will also strengthen reproductive health services and support women advocate for these rights. Canada is also working to empower and improve the health of adolescents through innovative partnerships that address the broader social determinants of health. All of this will help adolescents, especially girls. If we could just meet adolescents' need for modern contraception, for example, we could prevent 2.1 million unplanned births, 3.2 million abortions, and 5,600 maternal deaths. We must not let that opportunity pass us by. That is also why I encourage the meaningful participation of adolescents. They bring much needed energy, creativity, and passion. They also hold us to account. Speaking of holding us to account, there's millions of adolescent girls growing up in humanitarian context. These settings pose specific challenges for them, especially in regard to their sexual and reproductive health and rights. We cannot afford to ignore this in our humanitarian response. This is an example on how we will be working differently through our feminist international assistance policy. There is a tremendous amount of collective wisdom and experience in this room. Over the next couple of days, I challenge you to discuss how we can measure the progress we are making and what we need to do differently to make even more of a difference. I challenge you to think creatively about how to mobilize the resources and build and sustain the partnerships we need. These are big challenges, I know. But if we can rise these challenges, the benefits will be tremendous. Today, we are building momentum to create a global roadmap to achieve the targets related to adolescent health set out by Agenda 2030 and the global strategy on women's, children's, and adolescents' health. Momentum that we will continue to build together at the World Health Assembly later this month and at the Family Planning Summit coming up in London. We are well underway to ensuring that adolescent health is squarely on the global agenda. We are well on the way to making sure that adolescents are no longer left behind. Take a look around. In this room, we have representatives of Canadian and global organizations working to advance adolescent health, the World Health Organization, the World Bank, the Partnership for Maternal, Newborn and Child Health, and Every Woman, Every Child, donor, and developing countries. And we also have many youth leaders. We have an opportunity to shape the way forward on adolescent health together. We must keep the momentum going, because unleashing the power and potential of the 1.8 billion adolescents around the globe will truly transform our world. Thank you.